Hi, my name is Taban. I'm an oculoplastic surgeon in Beverly Hills. I'm also assistant clinical professor at UCLA. In this video, I'll be talking to you about facial aging in terms of volume loss and what treatment options are available. One of the main things that happens in the aging process is the person loses fat from the face and around the eyes. Imagine a balloon. If the balloon is deflated, air is let out, the balloon is going to collapse and wrinkle. The face is the same, except instead of air, it has fat. So when the fat goes away, the person is going to look older. So putting volume back in the face and around the eyes is going to give more of a youthful shape. When it comes to volume augmentation, there are two main types. Either autologous fat, that means patient's own fat is injected, it's taken from the belly or the legs and injected in the face and around the eyes, or synthetic fillers are used. Fat has the advantage of being natural and long-term. However, it is not predictable. Not all the fat that is injected survives, and that's the downside. Alternatively, synthetic fillers can be used, which are a lot more predictable. Now, there are temporary fillers, there are semi-permanent fillers, and there are permanent fillers. I do not like to use permanent fillers around the eyes. Being an oculoplastic specialist, I get patients from all around the world who come to me to have fillers injected around the eyes, especially in the upper eyelids where it is more complex and not many people do it, but even for under eyes. When it comes to the eyes, as I said, I do not like to use permanent fillers. I use mainly hyaluronic acid gel fillers, bilateral, Restylane. The goal of facial and eyelid fillers are to restore volume, but it's critical that not too much filler is injected. It's critical that the filler is injected in an appropriate deep layer, and it's critical to use the correct filler for the correct area. All those things will give you the best result, and the result needs to be natural. I hated fake look when the patient is overfilled, either overfilled cheeks, lips, or when they do the eyes, the under eyes, they get too puffy, they get the Tyndall effect. So prevention is key, and preventing it is using proper technique, proper filler, conservative amount of filler. Those things are all critical. The common areas I inject fillers are upper eyelids and under eyebrows, under eyes to improve the dark circles and the hollowness, in the cheeks, in the lips, along the jawline, and in the temples. When it comes to under eye area, when there is hollowness, it creates this dark circle effect. And because the eyelid skin is so thin, it's really critical for the filler to be very deep and be conservative amount of filler injection and use the correct type of filler. So technique is very important. When it comes to the upper eyelid, it's even more important to use proper technique. There are many critical structures. You want to be as deep as possible, right underneath the eyebrow in the upper eyelid, above the eyelid crease. And again, you want to undercorrect. The goal is to obviously give the eyes more of a youthful, natural shape. One important difference between eyelid filler and rest of the face is fillers around the eyes last much longer than the rest of the face. So if you were going to inject Restylane under eyes or in the upper eyelids, it tends to last about a year, year and a half, maybe longer. But the same filler in the cheeks or lips will last about 6 months. One more other important point is a second time the filler is injected around the eyes, it has a tendency to last much longer than the first time. So a common question I ask is, doctor, how long does the filler last and how often do I need to repeat it? When it comes to the eyes, as I said, the first time is expected to last about a year, year and a half, and the second time lasts much, much longer than the first time. So it's not something that you keep repeating every 6 months or every year or even if every few years. For the upper eyelid hollowness, again, it gives the eye more of a sunken, aged, skeletonized look. So when you add volume, it really makes a big subtle difference. I was the first person to ever publish on using fillers in the upper eyelid, and I've been using it ever since. I get patients from all over the world who come to me for filler injection around the eyes.